Meanwhile, a fresh collaboration between the Office of Nigeria's First Lady and the Federal Ministry of Health is set to address child malnutrition in the country with a scheduled launch of the National Community Food Bank Program. Nigeria's First Lady announced the launch of the program at the opening ceremony of the National Traditional and Religious Leaders Summit on Health 2026. State House correspondent Adeniyi Taiwo reports.
Building a resilient health system, one of the key priorities of the Bola Tinubu administration, requires a whole of the society approach, which in turn demands deliberate involvement of key stakeholders, particularly traditional and religious leaders. The 2026 National Traditional and Religious Leaders Summit brought leaders of faith and tradition together under the same roof. The intent to harness their trust and voices for the health of Nigerians. With the summit acknowledging the symbiotic relationship between lack of good food and acute malnutrition in children, the first major assignment for leaders here is to drive advocacy and awareness for a national food bank program announced by the First Lady, Oluremi Tinubu, and set for launch in April this year.
This program is designed to strengthen community nutrition support, improve access to safe and nutritious food for vulnerable children, and contribute meaningfully to the national response to ending child malnutrition. The program will operate through the nationwide network of primary health centers to identify and register eligible families with children under 6 years old. Caregivers will receive counseling, be given food vouchers that they can redeem for nutritious, locally grown food at food banks that will be established close to the health centers.
For a successful campaign, the intervention targets expanded collaboration with key public and private financial institutions.
This initiative will be funded through a trust fund by willing private sector partners and well-meaning Nigerians to ensure accountability. The trust fund will be overseen by credible Nigerians, chaired by the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, not me. We will be needing a lot of support from you, our revered traditional and religious leaders, to ensure no eligible family is left behind as we roll out the program nationwide.
For the Coordinating Minister of Health and Social Welfare, a lot has been done by the current administration to bring healthcare delivery closer to the people, but more can be achieved through dialogue with critical stakeholders.
Leadership that we are calling for does not end in this hall. It must live in each and every one of our communities all over this country.
We are the closest to our people. We don't lock our palaces. It's about time for our political leaders to utilize the strength in us for us to better the lot of our people.
Let us return to our domain as ambassadors of health, equity, and hope.
In goodwill messages, World Health Organization and other partners lauded Nigeria for leveraging voices that can reach places where political leaders and even healthcare workers cannot reach. From the conference center of the Presidential Villa,